Well, the best thing to do is to go see a dermatologist. They specialize in skin cancers, and they can do a biopsy if they're suspicious. But the first thing is if they have any changes or any abnormalities, they note that's been persisting for 3 weeks. That's usually the cutoff I give. If you've seen it for 3 weeks, you've been bleeding somewhere or something's going on, the last 3 weeks, then you should go see the dermatologist.
What would be some signs like changes in color, growth, scabbing?
You could have scabbing, you could have bleeding, changes of colors, growth. Those are all indications of something going on.
Treatment for it is usually what if it turns out to be, whether it's basal, squamous, or melanoma? Where do you break those down?
Well, melanoma is the standard of care is to do surgery. And in the United States, that's universally accepted unless there's a medical contraindication to it that would be done. In Europe, they often use radiation up front, and the results have been pretty good. But here, for sure, I would just offer surgery. For squamous cells and basal cell carcinomas, it's really a decision that the patient has to make in conjunction with the doctor, because a lot of times there's a cosmetic issue with surgery. The patients are on blood thinners. It may be in an area where it can cause significant difficulty in healing. It could be, for instance, below the knees. Most elderly people have vascular compromise below the knees, and therefore if they have a cancer removed, they might have significant healing problems. Also in areas of thin skin, they could have problems maybe like in the back of the hands or on the scalp. The other thing is in areas of the face, for instance on the lip, the surgery could cause a distortion. They could have trouble with their eating, stuff like that. And also in certain areas by the nose, it tends to be a deeper area than it appears, and therefore surgery could be quite debilitating.
So, if at all possible, try to avoid surgery and maybe do radiation therapy for cosmetic reasons alone?
Well, cosmetic reasons, usually we will get a better cosmetic result than surgeons. A lot of people are not going to be so concerned about it. They want what they call convenience of surgery, assuming everything goes right with surgery. But not everything always goes right, and especially if you're getting radical surgery like Mohs surgery, they can take hours, and then there might need to be a closure, which could take hours. So the radiation can be much easier for the patients, and really the best thing to do is get an opinion. Then the patient can make a knowledgeable decision.
When you're dealing with melanoma and you have surgery, do you usually follow up with radiation therapy?
Not necessarily. It really depends on how good the margins are, and whether there's a suspicion that there could be some spread nearby.
And we're entering now, well, it's suntan season here all year round, but summers people are more on the beaches. Any words of advice right now?
Well, look, I mean, obviously, I tell everybody they should avoid the sun, but that's, of course, very hard. But if you can limit your hours to before 10 o'clock and after 4 o'clock, and, of course, wear sunscreen.
Every day, right? Not just when you're going to the beach.
For sure.